Healthcare has evolved from a cottage industry that focused on restoring and maintaining individual health to a highly structured system that prioritizes the provider over the patient. However, healthcare providers are now shifting their focus towards a more patient-centered approach. This session will be moderated by Andrew Benedict Nelson, a healthcare futurist and social change specialist.
Who you have before you are 3 clinicians, 2 nurses and 1 physician. We're here to talk about personalization, but I'd also love for you to say something about what being patient-centered means to you, where you learned that idea, how you practice it today.
I would say that I can tell that I'm patient-centered too when I'm able to spend time with the patient and connect with them, knowing that my patient feels comfortable with me, knowing that we've built that rapport is when I know that I'm delivering patient-centered care.
Patient-centeredness for me is really about that high-touch engagement with the patient's goals and values, and making that happen on a dynamic sort of longitudinal way, letting myself be a little bit more in collaboration with the socialized patient, if you will, rather than sort of the top-down approach. But
thanks, Luca. And Rebecca.
Hi, my name is Rebecca Marsh, and I'm also a registered nurse, but my title is clinical nurse educator. So while I mostly work with nurses and I mostly work to write hospital policies that standardize care, I'm available to bedside nurses for consultation on particular issues that might be unique. And so I also exist to help personalize care plans. And I would add on that and say that sometimes when a policy or a procedure doesn't fit the patient, we can do everything it takes to make it work. And what I would like for people to know about many nurses is that we often base our professional satisfaction on our ability to care for others. And that's what tells me that I'm patient-focused, is that what I could do is never enough.
You know, I've taught pre-meds and I'm always so happy to see how much they want to care for people and how excited they are about what they're going out and doing. But we know that those thousands of new clinicians every year, they hit serious obstacles and headwinds to personalization and to being patient-centered. So to our panelists, what would you say are those most serious obstacles to providing personalization in healthcare?
Well, I was kind of already talking about protocols. There's a protocol for everything, and it's really good when you're new. In fact, and it's really good to have standards. I'm not at all trying to say that we shouldn't have standards of care, because it's impossible to know everything that you need to know in healthcare today. You learn to read protocols, and through them, you can get an outline of a safe, evidence-based way to do the thing that you need to do. And so not every patient fits these protocols, though, and the structure of how nurses' time is allotted is a real challenge. It becomes hard to be creative when you are on a time crunch. So I think it's so important to support new providers, new doctors, and new nurses to make a transition into practice, because it's not just the individual patients that we need to support, but the individual care providers.
I think the sheer complexity, not just of human organism, but also of illness, is a barrier to personalization. I mean, I think we sometimes forget how complicated integration challenges can be, right? The other thing is, I think our research doesn't quite match our instincts towards personalization, right? Like, I mean, clinical trials are great for groups of patients, but gives us very little information about what to do with the individual patient in front of us. I think personalization has to also be about addressing some of the social factors, right? The neighborhood, the family environment, or even the birth environment. It can also be about addressing the psychological coping skills. Yeah, I think if we're really serious, I think we can do a better job of even conceptualizing personalization to actually reflect what we want to actually do with it.
I've got something that it's not necessarily a negative, it's sort of a little bit of both. That's the role of technology. So most people, I think it's safe to say, who think about personalization, customization, have a pretty happy relationship with technology. But almost every person I know who touches patients has a pretty negative view toward technology and its role in the clinic, and its role in personalizing care. So could each of you speak to that role of technology in your experience and where it helps but also hinders our ability to provide care? And Aliko, you can start.
So yeah, I think that there's a lot of challenges with technology, but I mean, obviously it allows for standardization, it allows for research, it allows for aggregation. It's really important. There's no turning back. But I think we need to put more of the clinician's voice into the way we structure the technology so that it can serve the needs, not just for the clinicians, but even for the patients.
There's a lot of different advancements with technology. As we've said, there's a lot that are very challenging. That can be good for the population that understands how to use that and, the route of what that's for. But a lot of the population that I deal with, too, technology, I deal with a lot of elderly patients. It's not something that they're familiar with.
So I really think it's not the technology that's the problem or the patient that's the problem. It's the system putting interventions in without asking end users. It's allowed us to increase our capacity, but sometimes I think the meaningfulness has lost some of its potency for all of us. Because of the technology. So if a nurse works 12 hours and a third of their day is spent on a computer, how much is left for the patient?